Hi, I'm Kathryn Krase. I'm a lawyer, social worker, researcher, educator, and expert on the professional reporting of suspected child maltreatment. Over the past 2 decades, I have trained thousands of professionals who are required by the law in their states to report suspicions of child maltreatment to Child Protective Services, or CPS. Through my writing, presentations, and consultation work, I aim to provide professionals with the knowledge and skills they need to help families and protect children. You can find out more about me at www.craseconsulting.com, and you can find out more about my work in this specific area at makingthetoughcall.info. Today, I want to talk about the concept of autonomy. Autonomy is a fancy word used to describe someone's right to make decisions for themselves. Adults exercise autonomy every day when we decide what we want to eat, what clothes we want to wear, and what shows we want to watch. Adults generally have more autonomy than children. For instance, parents generally tell kids what they have to eat, what clothes they have to wear, and what shows they're allowed to watch. However, no one has ultimate autonomy over all aspects of their lives. For instance, you can't have any job you want. You need to meet the qualifications. Then there are laws and other limitations to what kids and adults can do. For instance, there are laws that say at what ages parents have to provide their kids with an education. And there are a whole host of laws that outlines parents' responsibilities to take care of their children. Those are the laws that I generally talk about in my work. The laws around defining what is child maltreatment can be considered an infringement on a parent's autonomy. Parents can't discipline their children however they want to. The law sets up limits. Parents can't leave children unattended whenever and however they want. The law sets up limits. These laws were put in place in an effort to protect children from harm. Another area of law that aims to protect children from harm is mandated reporting. Mandated reporting involves a legal obligation of certain adults, usually types of professionals like doctors, nurses, social workers, teachers, therapists, etc., to make reports to Child Protective Services when they have a certain level of suspicion of maltreatment. I can spend a bunch of time talking about how many laws that aim to protect children from harm set up unrealistic expectations for parents and how many of those laws unnecessarily restrict parental autonomy. But I'm going to leave that topic for another post. Today, I'm interested in exploring the concept of professional autonomy, especially when it comes to mandated reporting. We don't talk about the term autonomy in this context often enough. Professional autonomy generally means that professionals within medicine, nursing, social work, psychology, education, etc., we have the authority to govern ourselves. Members of a profession can come together to set up their own ethical codes, hold each other responsible for abiding by those codes. We can determine what's appropriate practice in our fields. We professionals use our skills at assessment, intervention, and evaluation all the time to determine, in conjunction with our clients, patients, colleagues, supervisors, etc., what's the appropriate course of practice in a particular situation. There's a high level of responsibility on professionals to have an appropriate level of skill to make autonomous decisions. In order to assert this responsibility, we have to earn certain degrees, pass certain exams, participate in continuing education programming throughout our careers. Professional autonomy ensures that the medical doctor gets to determine what treatment to recommend to a patient with a certain cancer, and a therapist gets to choose which intervention is best for a client who presents with post-traumatic stress disorder. Now, in reality, we know that there are tons of infringements on professional autonomy. Elected leadership of our professional organizations work with the governments at the state and federal levels to determine licensing requirements and other standards for practice in our area. A major limitation to professional practice comes from funding sources. For instance, if a professional takes insurance for their services or receives grant funds to provide a certain treatment, they may not have the full scope of autonomy that they ideally would want in a specific situation. They might be limited to fewer sessions or specific interventions when they truly believe their clients or patients need more or different help. Another situation where legal and ethical obligations infringe on our ability to be autonomous professionals is when we are required by law to make reports to Child Protective Services. Don't get me wrong. I'm not saying that professionals shouldn't make reports to CPS, especially when they believe that such a report will protect a child and help a family. What I am saying is that when professionals are required by law to do something, it means that we lose our own ability to make reasoned decisions, and that's what we are trained for and capable of doing. Consider, for instance, a parent who seeks therapeutic services because they're concerned about how high their stress level is and it's making it difficult for them to be the parent they wish they could be to their children. They aren't happy with how much they're yelling at their children or how much they're drinking alcohol at night to take the edge off. The professional might have a growing concern for the impact of the parent's behavior on the children's well-being. But the professional might also have a concern that if they make a report to Child Protective Services, the client will refuse to continue services and not feel safe seeking services with other providers in the future. The professional might fear how the disruption and trauma to a client and family can result from a Child Protective Services investigation, and how that trauma might be the straw that breaks the camel's back and causes the client to lose it. The professional might feel like making a report to Child Protective Services would cause more harm than good. The professional might feel like their work with the client would actually make the family more safe than evidence of a CPS intervention. And the professional might be right. But the law is the law. The law says that if the professional reaches a level of suspicion that requires them to make a report of child maltreatment, they have to make a report. The professional might not want to make the report, but they're also concerned that if they don't make that report, they'll get caught, get in trouble, and maybe even lose their license. The professional might make a report even when they know the report means more difficulty for their already struggling client. This is an example of the professional autonomy conundrum. So what should the professional do? I'm not in the business of telling professionals what to do because I believe in the strengths of professional autonomy. Through my writing, trainings, consultations, I help professionals explore the questions that I think should guide their decision whether they're required by law to make the call to CPS, but I will not tell them whether or not to pick up the phone to make that call. That decision is up to them. What can you do? I encourage professionals who are required by the law of their state to make reports to CPS when they have met a certain threshold of suspicion of child maltreatment, otherwise known as mandated reporters, to really think about situations where they feel the decision to call Child Protective Services is congruent with the requirement to make that report. And when the decision to make a report or not make a report might be in conflict with our notion of best practices. After all, we are professionals tasked with some serious responsibilities. The more thoughtful we are about our work, the more likely we are to do that for which we came to our careers to do in the first place, to help people be their best selves and support the world to be the best place it can be. To find out more about mandated reporting, check out my books, articles, blogs, videos, and podcasts at www.makingthetoughcall.info. And if you're interested in exploring training with me, check out my calendar of upcoming continuing education events or reach out to me to discuss opportunities to collaborate at Kathryn@kraseconsulting.com.